In today's health headlines, we are talking about the new New Hampshire Heart Disease and Stroke Prevention Action Plan. Joining us today is New Hampshire's Public Health Director, Dr. Jose Montero. Dr. Montero, thanks for being with us. Can you tell us a little bit about the action plan and what it attempts to do with what heart disease being the second leading cause of death here in New Hampshire?
Because these conditions in an aggregate are so important. You have their strokes, heart attacks, high blood pressure. It's really important that we bring all of the different resources together. When we talk about health as the resource that we as human beings have to be able to be productive. And part of that is the care that we get at the clinician's office or surgeries when we need that. But it goes beyond that. It goes beyond the engagement of the whole community, what we do as individuals. This plan brings all of these different elements together. We have great examples of partnerships going on in New Hampshire and how we can get better health. We have public health networks, 13 around the state. We have partnered with services for the elderly so they can decrease the amount of salt. We partnered with the YMCA so people can exercise. We are using clinical interventions like the one designed in the Cheshire Medical Center, and we worked out with Manchester and Nashua Health Department to improve outcomes in high blood pressure, and now Goodwin is going to use it. Department of Safety and EMS, we partnered with them to decrease strokes. All of these different things come together at the community level, where we live, where we play, where we walk. We need people to be able to walk and feel safe, to find the right type of foods and be able to purchase those. That is what builds community and keep us healthy.
How do individuals and regular citizens get involved with these networks? How can they get the information and what they need to improve their health?
Certainly talking with the clinicians is really important, but understanding that health is not just going to the doctor, but our own behavior and our own access to things. So we need to proactively try to be engaged, to be physically active. Great if you go to the gym, but we live in New Hampshire. This is an incredibly beautiful place. Go for a hike, walk a neighborhood, engage with your neighbors, go to a park. We have many of those. And try to eat as healthy as you can. Those are the two key things in this component.
We have some sad news for viewers. Dr. Montero will be leaving the state, employment with the state after 16 years serving the state of New Hampshire. Tell us what's next, Dr. Montero, for you here in the Granite State.
I don't feel that I am leaving. I'm going to be working at Cheshire Medical Center, actually as a VP of Population Health, which allows me to keep connected with things like what I just described. They have been pioneers in this community engagement and development, and it will be great to be part of their team and still connecting to what the agency, the Department of Health and Human Services, does for the whole population through the Public Health Division.
Dr. Montero, we've been very lucky to have you as our doctor here in this state, and it's been a pleasure to work with you over the years.
Thank you very much.
Thanks for your time.